Solid kidney tumors can be benign or malignant. In this illustration, using a cross-section over the right kidney, we see the renal cortex, the renal sinus, and we see a hyperechoic, well-marginated, solid lesion within the renal cortex. This is an angiomyolipoma. Angiomyolipomas, also called AMLs, are most common benign renal lesions with a strong female predilection. They're composed of blood vessels, angio, plump spindle cells, myo, and fatty tissue, lipo. Angiomyolipomas are benign, but they have a risk of rupture with bleeding. Here you see an ultrasound picture of a kidney with an angiomyolipoma. It presents as a hyperechoic lesion that looks like a snowball within the kidney. Take a moment to study the snowball within the kidney. Here we are looking at a cross-section on the right kidney where we see the renal cortex and the renal sinus. We can also see the hyperechoic structure of a AML, which shows a hypoechoic lesion. This is a rupture zone. The bleeding was contained within the kidney because we don't see any free fluid around the kidney. In this ultrasound picture, we see a ruptured AML. Since this is the right kidney, we can see the Morrison's pouch here as a thin echogenic line. In another situation where the kidney would bleed into the peritoneal cavity, the Morrison's pouch would be filled with fluid. We also see that around the kidney there is no fluid. So here we can see that the bleeding was contained within the organ. Take a good look at this. We have a long section on the left kidney showing us the renal cortex and the spleen, as well as the renal sinus. We see a slight hyperechoic cortical lesion within the left kidney, showing a spoke wheel hypoechoic structure within the lesion. This is a presentation of a renal oncocytoma. They are relatively benign lesions, and the main clinical importance of this lesion is that it is hard to distinguish it from a renal cell carcinoma. Their presentation, imaging, and histology are sometimes very difficult to distinguish from one another. Here you see a slight hyperechoic protruding lesion within the kidney cortex with a central hypoechoic spoke wheel structure. You can also see this lesion is not well marginated. Follow-up is essential, but as histology is often similar to renal cell carcinoma, they are primarily removed. Study this image looking carefully at the spoke wheel center. Now let's look at the ultrasound criteria of renal cell carcinomas with their three typical appearances. They can range from solid and homogeneous hyper- and isoechoic lesions to heterogeneous hypoechoic lesions with cystic components. The number one predisposition for renal cell carcinoma is smoking. We use a long section on the left kidney and we see the renal cortex and the renal sinus. We also see this enormous isoechoic solid lesion on the cranial renal pole. This is the ultrasound picture of an isoechoic renal cell carcinoma that has the same echogenicity as the renal cortex. You see the diffuse border between the tumor and the renal pelvis, as well as the surrounding fatty structures. Take a moment to get familiar with this carcinoma's appearance. This is a cross-section on the right kidney where we see the renal sinus and the renal cortex. Here we see a bump-like mass protruding from the renal cortex with an isoechoic presentation. As we remember that dromedary humps are only on the left kidney, this has to be a renal mass. We added Doppler and it was clear that this structure was highly vascularized. This was indicating an isoechoic renal cell carcinoma. Take a second to look at this. Here we use a cross-section on the left kidney and we see the renal cortex, the renal sinus. We can also see an exophytic mass lesion that is hyperechoic but shows dorsal acoustic shadowing. On ultrasound, you can clearly distinguish this mass lesion and its dorsal acoustic shadowing. We used Doppler and we saw that it was highly vascularized indicating that this was not a proteinaceous cyst, but a hyperechoic renal cell carcinoma. Look at the ultrasound image and note the presentation of this tumor mimicking a cyst. Here we have a cross-section on the right kidney where we see the renal sinus and the renal cortex. On the dorsal part of the kidney, we see a heterogeneous mass with cystic components, as well as tissue components within the structure, indicating a cystic renal cell carcinoma. On ultrasound, we can see the central cystic part in this mass lesion. We see that the borders are not well defined and the kidney's architecture is disturbed. Study the heterogeneous architecture of this kidney. In this video, we see the kidney in long section. You can also see that there is a mass lesion on the upper part of the right kidney. This lesion is isoechoic to the rest of the renal parenchyma and has a size of around 6.5 centimeters. This is the cross-section of the kidney. You see that there are cystic parts within this lesion. This is the typical presentation of a renal cell carcinoma.